Hi people, welcome back. So today, like I said, it's going to be talking about the role of a registered nurse in the NHS trust in UK, and what is expected of you if you're a registered nurse applying to the trust, NHS trust or hospitals in the UK to start working as a registered nurse. What is expected of you, the things you expect to be doing in the world. I know different trusts, like trust varies, like hospitals vary, and what you do in this particular hospital might not be what you do in the other one, but there are only slight differences, you understand? So there are only slight differences. I'm just going to be talking about the major rules, like generally what is expected of you anywhere you find yourself working, in any particular hospital you find yourself working. Like the role of a registered nurse does not change, you understand? It doesn't change. There might be slight on policies, like different policies in different trusts and all of that, that says, okay, you're allowed to do this in this particular trust, you're not allowed to do this one in this particular trust, but generally the rules are the same thing. So that's what we're going to be talking about today. My name is Joy Gonoche. Let's dive right into it. So, you're a registered nurse and you've just resumed the shift. What are the things you expect to do in that particular shift? They do write it they do put it in the job descriptions when you're applying for jobs, that this and this is what is expected of you, this and this is what is expected of you. But what do you think you should be doing? You come into work on a morning shift, for instance, like on a long day shift, because we do have long day, we have nights, like long days, which is 12-hour shift from either 7 a.m. or 7 a.m. or 7:30 a.m. depending on the trust you're working, or even 8 in some trusts, to 8 p.m. or 7:30 p.m. or 7 p.m. depending on when you start. So if you're starting 7 a.m., you're closing 7 p.m. Or 7:30 p.m. because you do have 30 minutes for handover. Then if you're resuming 7:30 a.m., you close 8 p.m. and all of that, as the case may be. So that's for long day shift. Then you also have the night shift as well. So night shift, like you can relate, starts from 7 p.m. or 7:30 p.m. or 8 p.m. depending on the trust you're working, and ends the next morning, that's 7 a.m., 7:30 a.m. or 8 a.m. So that's it, by the way. And talking about the rules now. So we normally do 12-hour shifts, talking about the rules. Say you resume a shift in the morning, you expect to, first of all, get handover. Like you do the handover, normal handover within 30 minutes. You have 30 minutes to do handover. So you have to make sure you come to work early, get dressed and all of that, change into your uniform. You're not allowed to wear your uniform from home. Most of the trusts don't allow it. I don't know if some do, but some don't allow it. So the right thing to do normally anyways is to bring your uniform from home and wear it when you get to work, because you don't want to be abusing the uniform. Is nursing and midwifery policy is not really per trust or something like that. It's something that nursing and midwifery don't really allow, even in Nigeria, which you are aware of. So you come to work, you change into your uniform, go for handover like 30 minutes, get to know about the patient in the ward and all of that, and then go do your introduction to your patient. And you do the introduction to whatever patient you're being assigned to that date, maybe depending on the number, if it's 5, 10, 7, 8, depending on the number you're being assigned to that very day. You go do the introduction, like introduce yourself to them, all of them, and then get through their files as well. Get to know what they are on, the medications they are on, what tests, blood results, blood tests that they need doing, the diets they are on, because as a registered nurse, you're also in charge of, your patient's diet. Get to know that, and, if check their blood results as well to see if he's getting, like, switching from normal to abnormal, like if he's still within normal limits, like their blood results, electrolyte values and all of that. If he's abnormal, your role also is to repeat the blood test. If he's not within the normal limits, your role as a registered nurse is to repeat the blood test. So you're allowed to take the blood from the patient. You also discuss this with the doctors as well during their handover. You can also place a call across to them, but it's within your role as a registered nurse to do blood tests as well, to make sure that okay, your patient's blood results is within normal, and do something to also correct that as well. Discuss that with the doctors now. And that's also, you're in charge of feeding as well. If for instance the patient is on NG tube, gastric tube, your role as well, your part of your role is inserting an NG tube, like inserting a gastric tube when it has been prescribed by the doctors, like the doctors prescribe it, and your role also is to insert it as well and then feed the patient through it. So you give the patients their NG tube feeding, like parenteral feeding and all of that through the tube, and make sure you take care of the tube, make sure it's clean, it's well properly inserted, and all that. And then urinalysis as well, if the patient is being inside, if the patient has urinary catheter inserted, your role is to make sure that it's draining well, it's clean, and everything else that is, your role is to insert it, make sure that it's draining properly, like observing septic techniques and all of that to insert it. I don't want to go into details again. Let me just give a brush, like because you definitely know what urinalysis is, for instance, you know what catheterization is, and you know what all these things is. So I'm just going to be bulleting the points now. Gastric tube insertion, urinalysis, catheterization, NG tube feeding, and admission. So admitting your patient. Say a patient has been brought. Your role is to do the admission, like admission protocol, by asking the patient their history, like taking history from the patient, physical history, medical history, like taking history from the patient, like medical history, social history, and all the histories that you can think of. Take the history, admit the patient in the patient center, and also discharge process as well is your role to discharge the patient. If the patient has been discharged by the doctor already, you discharge the patient on the system, and then give the patient the medications to go home with, and discuss how the patient is going to take the medications with the patient. So that's all about admission and discharge process now. And within the ward, patient is still on the ward, you do the hourly rounds as well, like you're taking care of the patient, like you're in charge of this patient now. You make sure that you do hourly rounds on the patient to make sure that the patient is okay, the patient is not in need of anything. Also make sure that a call bell is beside the patient, just in case the patient needs anything, that if they need anything, they'll put a call bell to call you and say, okay, nurse, I need this thing, or nurse, something is happening, or nurse, I'm in pain, things like that. And when they complain of something like that, you escalate to the doctor if he's not within your role, like within your jurisdiction now. Like for instance, they say, okay, for instance, they are vomiting, you do care plans as well. As a nurse, you draw out care plans, and then you follow the nursing interventions just to make sure that you get a good evaluation, patient is okay, get a good outcome out of it. So that's also one of it. So for instance, the patient is vomiting, you've done your nursing case, you also escalate to the doctor when it gets beyond your role, like there's nothing you can do about it again. Escalate to the doctor that, okay, this patient is vomiting, I've done this and this is what I've done, this is what needs to be done again, what do you think we should do, and all of that. So escalate concerns. If you've escalate concerns to the doctors, literally just escalate concerns that needs escalating. And also you collaborate with other members of the team as well, the doctors, the healthcare assistants, and other specialties in nursing. Say you're a ward nurse, you're a general nurse, you're working in the ward, and your patient, for instance, is a diabetic patient, it's having diabetes, and you collaborate with the diabetic nurse now. Collaborate with them and make sure that the patient is given the appropriate care, because there are different specialties in the world, there are different specialties in nursing. You are not to handle everything as a bedside nurse. It's not your role to handle everything. So collaborating with other members as well, that specialty nurses is your role to or if for instance a patient needs safeguarding, say they are having mental health issue, or they need safeguarding, or so happen that that they need safeguarding care or safeguarding contact, you make sure that you contact the safeguarding team as well, and book an appointment, book a referral to them as well, refer the patient to them. The patient can still be in the ward and also be doing this referral as well. So that's also that. And you also do the electrocardiogram, that's ECG monitoring. Patient needs ECG, for instance, say, they have concerns with their heart rate, blood pressure, any other thing, and they need ECG. Your role as well is to do it. You have to make sure that you're competent in, doing the ECG, in monitoring as well, doing observations, normal observations, blood pressure, temperature, pulse, and respiration, serving your medications, like serving medications to your patients as well. I'm sorry, I'm just going round and round, up and down, but I hope you can understand me. So, like, coming from the admission to discharge, your role is to admit patients, get the patient to the ward, get the patient a bed, an appropriate bed, give the patient call bell to ring if there's any concern. Make sure that you do the observation, vital signs. If the patient needs NG2 insertion, you're there to insert it. If the patient does not, just make sure the patient is comfortable. Literally, if the patient has been prescribed some medications by the doctor, like, make sure you know the diagnosis of the patient as well, because if the patient is prescribed some medications, you want to make sure that these medications are also safe for the patient to take in. You understand? They are not harmful for him or her to take. That's why you should have have knowledge about the different medications and know what you're serving your patient, because errors can occur sometimes. Doctors can also make errors, like do some medication error, and it's your job to actually notice these errors on time before it gets too late. You understand? So that's also one of your roles as a nurse here also. And all those things like that, all those little nursing cares. You also work side by side with the healthcare assistant, so because they are there to assist you as well. They are there to help you with the non-nursing roles, like maybe do the observation sometimes, but the first observation, the first vital signs, is your role to do it. They can do subsequent ones later on, and you have the baseline just to assist you, like give you a hand in it. They do the dressing of the bed as well, but if they are not there to do it, it's your role to also do it. You understand? If they are not in the ward to do it, it's your role to do it. Normally it's your role, it's just that they are there to give you a hand, because some of these things can become too much sometimes. Like, it can become too much, and that's the reason why they are being employed, to actually give you a hand. And then you also have cannulation, which you know is very, very important. It's your role as a nurse, as a registered nurse, to cannulate your patient if the patient needs IV fluid or IV medications going through their veins. So your role is to cannulate. Your role is also to take blood. It's your duty to also take blood in the ward. Take bloods, order blood tests, do blood tests, repeat blood tests if needed. If okay, they are not going back to normal, repeat them. Also discuss with the doctors as well. But liaise with the pharmacies, like if there's a medication that needs ordering, order them from the pharmacy. Discussing with your coordinating nurse as well. Definitely, like there should be a band 7 nurse in the ward, at that point, like at every shift. So you discuss with them when you need ordering of medication as well. And intake and output chart, monitoring intake and output chart, doing blood glucose monitoring, like blood glucose tests, to check the blood glucose, blood sugar of your patient. And you also know that it's your duty to give oxygen. Like, if the patient needs oxygen, it's your duty, it's your role to give oxygen. Oxygen administration is part of your role as well. Blood transfusion, say, the doctor has ordered some blood to be given to this patient. It's your role to actually give the blood, and make sure you do the vital signs pre and post and during the blood transfusion as well. Make sure that the patient is in a good state, and the patient, the blood is compatible, like with the patient's blood group, and all of that. And all those things like that, like all these little things that you've been doing before. But then we also have wound dressing. If your patient has a wound that needs dressing, it's your duty as a nurse to do the wound dressing. Like, make sure it's done under sterile, like aseptic procedure. And also positioning the patient as well, say changing the position frequently, every hour, every 2 hours, depending on what is indicated for this particular patient. Making sure that you take care of any pressure ulcers, pressure sores, prevent pressure sores from happening, and if they happen, it's your duty to take care of them as well. Make sure that the patient's bed linens are clean, they are okay, like dry, they are not squeezed or rumpled or something like that. Rumpled. You understand? And what's there again? So those are the few I can. Meals chat as well. Meals chat is your duty to also fill this VIP's call and chatting and, documenting, making sure you document every caregiving. Documentation is a vital process of everything you're going to be doing. You understand? Every care you're going to be rendering, every nursing care, documentation is the basic thing. Like making sure you document these things just so that for instance, somebody else wants to do this thing and they go to the patient's chat and they see, okay, this thing has been done already. I don't need to do it. This is the stage you're in. I don't need to do this one. Or somebody is handing over care, like taking over care from you. The person has to see what you've done before and know, so that you avoid medication error, you avoid every other error as well. And also, document it shows that you actually did this thing. If you don't document, it's assumed you didn't do it. So if anything should happen later, you don't have any backup to say, okay, I've done this particular thing. There is nothing there. It's assumed you didn't do it because you didn't document it. So documentation is very important. It's as important as what you're actually doing. It's as important as the care you're rendering to your patient. Documenting them and making sure like it's a part of safe care, like safe care rendering. So it's very, very important as well. And like I said before, discharge process, giving medications, take-home drugs, booking appointment for the patient if needed, like that's just it. So that's just basically it. So thank you for watching, and if you like this video, give it a thumbs up and don't forget to subscribe to my YouTube channel, and I'll see you next time. Bye bye.